Alright, welcome everybody. My name's Olga. I'm one of the GPs working at the Shepherd and Women's Health Centre, and today I'm going to be speaking to you about our Well Women's Health Check. So, by the way, actually, I'm holding this for a reason. You have in your show bags this little brochure which gives you a bit of a synopsis about our Well Women's Health Check, so please have a look at that. So what is our Well Women's Health Check? So our Well Women's Health Check is an individualised and comprehensive checkup for women of all ages. We ask that you allow an hour for our Well Women's Health Check, and that's because we allow about a 30-minute consultation with the nurse, and then you'll have approximately 30-minute consultation with the GP. The Well Women's Health Check will consist of discussion time, examination, education, possibly some ordering of tests, and finally formulation of a management plan. When you come for a Well Women's Health Check, the first thing we're going to ask is, what do you want to get out of a Well Women's Health Check? I think we all realise that women at different ages and stages of their life all need different things. So I guess, for example, if I was 25, my priorities might be contraception, screening for sexually transmitted infections. I might want to discuss alcohol, smoking, all of those things. Whereas if I was, say, 55 and my mum had breast cancer at the age of 60, dad had a heart attack at 65, this might be more concern to me. Okay? So why is a Well Women's Health Check important? So the purpose is to detect early disease in apparently healthy individuals, thus reducing future illness. Down below I've got a nice little quote which is from a Royal Australian College of GP publication that says it's estimated that 80% of premature heart disease, stroke and type 2 diabetes and 40% of cancer could be prevented through interventions that lead to healthy diet, regular physical activity and avoidance of tobacco products. For me, that's incredibly impressive, and I think that really hits home why this is important. So we said before, there's lots of things we can talk to you and discuss in a Well Women's Health Check, and I've listed here possibly some of the more popular things that we talk about. So asking a woman about diet, exercise, is she smoking, how much alcohol is she consuming? And the next one I've got is cardiovascular risk and diabetic risk. So what this means is you can, I guess, have a blood test which tells you whether you have diabetes or you don't. If it says that you don't have diabetes, I guess the next question is, well, what's my risk of having diabetes in the future? And you can plug in series of factors to things like, are you a smoker, what's your age, etc., etc. They're called risk calculators, and you can actually find out your risk of these things. So I'm low risk, my risk of a heart attack is 10%, 5%, etc., etc. And I think this is quite a nice way of providing women with education and information. So we'd be keen to do that for women. We've mentioned before sexuality, providing education on safe sex, screening, treating for sexually transmitted infections, dealing with reproductive health issues, such as periods, problems and concerns, contraception, are you on the right contraception, are you happy with your contraception, information regarding conception, and then on the other flip side, the other time of your life, you may need some help with menopause. And we've got also incontinence and pelvic floor. Breast health is incredibly important for all of us. And the key message now is this one of breast awareness, so that women should be aware of how their breasts normally look and feel and report any unusual changes to their doctor. Other topics, mental health, stress management, depression, anxiety, personal depression, etc., etc., huge one. And of course bone health and people's risk of osteoporosis. Oh, I'm going the wrong way. Okay, within examination I've listed a few things here. Weight, your body mass index, we can calculate that. Check your waist circumference. Waist circumference is an interesting one. The bigger we are around the waist reflects the amount of internal fat, which then also that amount of internal fat directly correlates with your risk for cancer, heart disease, diabetes, so it's a good one to be looking at. Checking people's blood pressure, and then as needed, other examinations such as pap smears and checks down below for things like prolapse, infections, etc., breast checks, skin checks, etc., as needed. Then as part of the Well Woman's Health Check, in some cases we may order some tests. Often we may order some blood tests, things like cholesterol, sugar, and others as needed. Or we may do a pap smear. We may, as we said, do some swabs for looking for infections, possibly some blood tests. We may even suggest to a woman that she needs to have a mammogram or a breast ultrasound, or recommend a referral to breast screen. Speaking about the mammogram, breast ultrasound, quite excitedly we've partnered with Goulburn Valley Imaging to provide a same-day service breast ultrasound and mammogram. I think this is especially useful for women who live out of town. So if they come in and have our Well Women's Health Check, we'll aim to have on the same day that mammogram and breast ultrasound. Other things we may order or recommend, bowel kits, which of course are there to help reduce the likelihood of bowel cancer. And of course, looking once again at your bones, possibly the ordering of a bone density scan, which is of course looking at osteoporosis. That sort of tells you a little bit about what the Well Women's Health Checkup is all about. And I thought it might be a good time to just let you know what else we have available at this site. And I think after your Well Women's Health Checkup, we may decide that you need referral to some of these people. And the people we have on site are, of course, Dr. Stegman, our obstetrician gynecologist, Fiona, our physiotherapist, who you'll be meeting soon as she's giving you a talk, Carol, who's our psychologist, and of course our women's health nurses, Donna and Gay. And just quickly to mention about Donna and Gay, they're pap smear providers. Donna is our diabetic educator, quid educator, and they're both able to provide ongoing education and support. So if we determine in your Well Women's Health Checkup that you need to lose weight or you need to quit smoking or whatnot, we can link you in for further visits with our health nurses to try and help you with those goals. And of course we have our Gorovich pathology collection on site. So just to quickly wrap it up, so in summary, we asked you to allow 1 hour for our Well Women's Health Checkup. We aim to provide a comprehensive service. This isn't 10-minute medicine. We aim to give you a really good chance to discuss and for us to have a look at you and give you some good follow-up and management plans. I like to look at us at the Shepparton Women's Health Centre as a one-stop shop. We've got lots of good resources and people on board here. All female staff who have a passion for women's health. Cost-wise, it will be time-based. Approximately the out-of-pocket cost is about $54. And of course, if you'd like to come and have a Well Women's Health Checkup, please contact us or also speak to one of us tonight. And that's it. Thank you.